Welcome to Health in Today's Woman. I'm your host, Dr. Kelly Williams. As always, this show is designed to help women become champions of their own health care. Tonight we have chosen a very important topic in vaccines. With the flu pandemic going nationwide and worldwide, there's a new focus on vaccines. Tonight I'm very lucky to be joined by several pediatricians and by a patient who chooses not to vaccinate her children. We want to start off, though, by talking to Dr. Lee Bigham, a pediatrician at the Murfreesboro Medical Clinic in Murfreesboro, Tennessee. And Lee, I want to thank you for being here.
Oh, sure, Kelly.
And I really want to kind of start off with the discussion of there is a really good success story, and we were talking about before we started, about the HIV vaccine.
Sure.
I want you to tell me a little bit about what this is, and tell me a little bit about the success that's been associated with this.
Sure. Haemophilus influenza B is a bacteria. It sounds like the flu, and a lot of people get confused with that, but it's actually a bacteria that caused fairly significant illness in children. The main things that we were worried about as pediatricians were meningitis and something called epiglottitis, which is where you get basically the flap that goes over your windpipe gets inflamed and clamps off when it shouldn't, and you quit breathing, which is bad. This vaccine came out in 1987. I started medical school in 1989, and I've seen one case of Haemophilus influenza B disease, and that was in a patient of a partner of mine who had decided not to vaccinate their last child. It was significant enough that we sent the child to Vanderbilt when we figured out what it was, and I think every person at Vanderbilt went to go see this child because no one there had ever seen it, at least the new doctors.
Well, that's interesting, because I think that's one of the things about vaccines that's interesting is that, we're getting to where we don't see these particular infections, and it's good that we don't see these particular infections. What other vaccines, what other infections are we treating with vaccines other than HIV? HIV is a great example of a success.
Well, and it's probably easier to go through just the logical progression that we recommend in the office. And it's I guess the sequence that's been recommended and that we fairly adhere to with some variations. But we start off with the hepatitis B vaccine that's usually given in the hospital setting. It doesn't have to be given there, but that's when most of it is given. At the first visit, we give the diphtheria, pertussis, tetanus vaccine, or DPT, the polio vaccine, and the HIV vaccine that we've been talking about, as well as the second hepatitis B at 2 months, I'm getting sidetracked, the Prevnar, the pneumococcal vaccine, which is also another vaccine that a lot of folks know it as the ear infection vaccine. Most pediatricians know it more as a meningitis or really bad pneumonia vaccine. And then there's also another vaccine called Rototec, which is an oral vaccine. It's not a shot. Like most of these, all the other ones I've mentioned are a shot. Rototec is a vaccine that helps prevent rotavirus, which is a diarrhea virus. And I heard this described by someone on CNN as, I can't believe we're vaccinating for diarrhea. This isn't just simple diarrhea. It's more of just imagine 104-degree fever for a week and raging diarrhea, not being able to keep anything down from either end. The dehydration potential is horrific. It's probably not as big of an issue in this country as it would be in some developing countries where access to medical care is not as ready.
Actually, when I was in college, I did a paper on this. I did a paper, and the #1 killer of children in the world is dehydration.
Right.
So this is one of the main things
This is one of the things that causes it, exactly.
And I think it's interesting that you bring this up because we discuss vaccines. Oftentimes we think about ourselves, but vaccines have a further progression. We are using vaccines in the world, whereas we don't think about the fact that diarrhea, we can control that. We've got all kinds of options. In the third world, they don't have that.
Right.
And so when we're talking about vaccines, we're not just talking about vaccines in America, we're talking about vaccines everywhere.
Well, and I think it's, we kind of throw around the term third world or developing country a lot, but there are a lot of people in this country that don't have ready access to medical care. And so those diseases can be just as debilitating to Americans as they can be to anyone. So it's not just a simple fact of, oh, you're an American, you'll have great health care provided for you.
That's a good point.
So it's certainly still a very pertinent issue here or we wouldn't be vaccinating for it.
And I want to take a little bit of that because one of the things I want to ask you is, as a pediatrician, do schools in Tennessee require that kids are vaccinated before they enter kindergarten?
They do, and what I was going to say, I'd gotten through I guess the first few months of vaccines.
Okay.
The shots that we typically give it a year are the measles, mumps, rubella, the chickenpox, and hepatitis A. And those vaccines that I've just mentioned are given at different times throughout life up until age 5.
Okay.
And most of those are, I think the Prevnar has typically not been recommended or required. Some of those are going through changes now as far as what they're requiring to get into kindergarten.
Okay.
There are exemptions that you can sign for if you choose not to vaccinate your children.
Okay.
And they can still be in school. And it's actually a fairly easy thing to do. A lot of folks just assume that, oh, well, you have to be vaccinated to be in school, and that's really not true.
Interesting, because I didn't know that, and that's one of the big questions I think people have is this whole idea of can you get into school if you don't vaccinate your children?
Oh,
I want to say
certainly.
one other thing real quickly, and that is you can combine vaccines, and that's one of the things I know you mentioned. We do give several
Right.
vaccines at one time.
And there actually is a combination vaccine that we give. There are two different types. One's called Pediarix and one's called Penicil.
Okay.
And they're variations on the same theme. The one that we give in our office currently is Penicil, which is a combination of the diphtheria, pertussis, tetanus,
Okay.
the polio, and the Haemophilus influenza B. And that's given, those are 3 different vaccines. And actually, I guess you can make the argument that's 5 different vaccines given in one shot.
Okay. Well, when we come back, we're going to be joined by a complete panel of pediatricians, and also by a patient who doesn't believe in giving her children vaccines. See you after these messages. Welcome back to Helping Today's Woman. Tonight, we're doing a show on vaccines. In our first segment, we talked about what we're vaccinating against. In this segment, I really want to take a look at some of the controversies that are associated with vaccines. I have assembled a great panel to talk about vaccines, and I want to introduce them to you now. First, this is Dr. Brent Rosser. Brent is a pediatrician at the Murfreesboro Medical Clinic. This is Miss Nicole Mitchell, who is a patient who chose not to vaccinate her second child. This is Dr. Kathy Dundon, who is a pediatrician at Goodville'sville Pediatrics. And this is Dr. Derek Johnson, who is also a pediatrician at the Murfreesboro Medical Clinic. Now, I want to start this discussion with Nicole, and I want to say, first of all, thank you for coming, because I think this is a great chance for you to explain why you choose not to vaccinate your children. And I want you to feel comfortable doing that. But I want you to start off with, why do you not vaccinate? Did you choose not to vaccinate this child when you did vaccinate your older child?
Well, I had my first son when I was 23 years old, and that was almost 15 years ago. And I didn't do a lot of research then, actually none, but I decided to take a different approach with my second son and weigh the benefits as well as some of the negative aspects of vaccinating.
Okay, now I want to ask you a little bit, what did you see as some of the negative aspects of vaccinating that you really made your decision for you?
Well, I was very concerned about some of the risks associated with the vaccines, and of course, autism is the biggest one that you hear about mostly in the news with vaccinating. But some of the other things, I read a lot of the manufacturers' inserts on the internet as far as what some of the side effects could be, and some of those things were really concerning to me.
And one of the things I want to kind of expand this to the panel, because I think this is very important. Before we go to there, I want to ask you a very important question. Have you been discriminated against? When you did not choose to vaccinate your child, did you have a hard time finding a pediatrician who would take you?
No, actually not. I did not. I actually had a consultation visit with appointments set up with about 3 different pediatricians. But I was fortunate and blessed that the very first pediatrician that I met with, which was Dr. Johnson, he made me feel comfortable. He did not say that he agreed with my decision, but he did say that he would accept my decision and work with me and my baby.
Well, good. Now, I want to kind of expand this to everybody because I think this is such a great topic. Do y'all take patients who don't vaccinate? Obviously, Derek does because he takes Nicole. What about, Brent or Kathy? Do you take patients that don't vaccinate? Why don't we start with Kathy? Do you take patients that don't vaccinate?
I encourage people to, and I'm always trying to talk my practice into, but they have a lot of concerns. One of theirs is risk to other patients. In fact, some states have suggested that there should be a separate waiting room because unvaccinated children coming in could spread a disease, just like it's important for my staff to be vaccinated for H1 so they can't give it to the patients when they come in. But that's smaller. The other is there's a trust factor. There's an awful lot of science, and it's like speaking French. If you don't speak French, you really, no matter how hard you read, the internet is full of misinformation. It needs to be a reputable site, and I've read the it would fool most everyone, even college-educated people. Just like if I want to make a decision about something with a heart of a child,
Right.
I could try to research it, and I read 2 papers that say, with that condition, I should do this. And I think that's what I should do. But then I call the cardiologist, and they say, oh no, there's 6 more papers that have come out since then that really spell out here. And over in Harvard, they've just done this research. So the standard right now is this is what's best. There's no way, no matter how much I read, I can know what the cardiologist knows. And so I have to depend on him.
Right.
The same with the neurologist. And so I think the doctors in my group feel like over time, if we continue to work with someone, that we should build a trust factor. And if we really think vaccines are the best thing for children, that there's something wrong with the trust factor over time, because there's so much bad information.
Right.
People can't come in and not know me and just believe what I believe. It's over time. But
And I think, Nicole, what do you have to say about that? Because I think it's interesting, because we got 2 different views. And what do you say? You did do your research, and which is not necessarily what everybody does. What do you think about that? Do you think there's a trust factor that, now I may want to vaccinate later?
There is always a possibility. It's not something that I'm just totally against. I think more so than anything, I wanted to wait until he was older and then maybe give that some consideration at a later date. I was more concerned with giving him the vaccinations when he was first born.
And that's a great point, because I think a lot of patients have that about, it's not necessarily that I want to do this, don't want to do this, I just don't necessarily want to do it now. Brad, I want you to get your throw in your 2 cents also.
Well, I will accept patients of families that decide not to vaccinate, and as was explained earlier, you have to spend time with those families and discuss it with them and try to educate them. And sometimes they have their minds made up before they come in. Sometimes they just want my input on it, and then they go home and discuss it. And oftentimes they will decide to vaccinate. Sometimes they won't. But I will support their decision. And I understand that people's reluctance to vaccinate. But I'm not there to change their minds. I'm there to educate them. And as was said earlier, some of my patients feel uncomfortable vaccinating when their children are babies.
Right.
And they like to wait and make sure that they're healthy, that they develop well, and that they're on track with that, and they'll vaccinate later. And so that discussion comes up a lot too. But I try my best to vaccinate, and I explain how my children are vaccinated. I think that helps a lot, because a lot of parents want to know what I do for my own children.
Right.
And I have 3 children, they're all vaccinated. And so education is a big part, and that trust factor is a big part too, but I don't refuse to see patients if they're not vaccinated.
I want to take just a second here, because I think I've heard something that I really want to bring out, and I think it's such an impressive thing as what we've seen in medicine today, and that is I think we really are trying to move towards where having patients have importance. Their health care is important. When we come back, we're going to take a further look at this whole controversy with vaccines. We'll be back right after these messages. Welcome back to Health in Today's Woman. Tonight we're discussing vaccines. In our first 2 segments, we had initially discussed about the vaccines and what we're vaccinating against. In our second segment, we began to understand a little bit about why some people choose not to vaccinate. In this segment, I want to look a little bit more at when you do vaccinate, what are some of the risks that can be associated with vaccines? And we're very lucky to have our panel rejoin us. And Kathy, I want to kind of start a little bit with you, and that is the whole idea of autism. I know that Nicole brought that up as one of the things that's really highlighted in the internet, is this whole idea of autism. Can you give us a little bit of an understanding of where this all began? Where do we get here that autism was associated with vaccines?
yeah. Well, part of it's timing, because autism doesn't appear until the 2nd year to a general eye. They're now getting developmentalists that can tell in a 2 or 4 month old
Okay.
by the way they interact, but it really takes a sophisticated developmental specialists to see it that young. So typical pediatricians like me or parents might have a symptom of it after 12 months.
Okay.
And the MMR is usually given at 12 to 15 months.
Okay.
And there are other vaccines given then. So I'm not quite sure initially why someone chose to grab that. But what happened was in England, there was a physician named Andrew Wakefield, and he published a paper in Lancet where he said he had 8 children, and they were autistic, and he had isolated measles virus from biopsying their bowel.
Okay.
And he was proposing that it was from the MMR, the vaccine has a live virus,
Right.
and that had caused these children to be autistic, and it
Okay.
got published in Lancet. Now, of course, when it involves children, that hit the media, and he did 1,400 interviews in 2-3 years.
Okay.
They even made a movie with him, like he was being persecuted and followed by the pharmaceutical companies, and
Okay.
they were trying to silence him and tapping into his phone, and so he was playing like the conspiracy theory thing.
Right.
Well, now that all it's been elucidated, there was a reporter in England who really showed the true story. And then there was a huge court case in the United States, a class action lawsuit about measles, mumps, rubella,
Okay.
and autism. And what came out is Dr. Wakefield, who lost his medical license over all this, he didn't ask permission from the hospital to do the study.
Oh, okay.
He perforated one of the children's bowels in biopsying it, and they almost died.
Oh, wow.
And so I do studies, and you have to go through enormous committees. He didn't go
Right.
through any and was doing unauthorized research.
Okay.
And then it turned out that half the children were actually of families that were trying to sue vaccine companies for the MMR causing autism. And he
Okay,
had
that's
used them to isolate their bowel, and that he had received $1 million from the attorney in order to do the research to show
Okay.
that autism was caused by MMR.
Interesting.
But it still lit a fire. It went all across England, and they had not seen a case of measles since the early 60s when the vaccine first came out. And measles is not cute. And they got hundreds of cases of measles, and 4 children died. No one had died of measles in forever
Okay.
because the vaccine rates dropped. Well, now all that he's been shown it's not true. They withdrew the article. The court has
Right.
been exonerated. But he moved to the United States, and he doesn't have a license, but he works, I think, down in Texas with some physicians in the United States who do have licenses. But he's very charismatic and a beautiful voice, and
But
it's
that's an
difficult.
important thing, because I think a lot of people have wondered, as I know Nicole mentioned when we first opened the last segment, that autism was part of this, and it's interesting to know where all this comes from, because it's got to come from somewhere. We don't just start with this. This is a progression, and I think it's interesting that where did this research come from? And sometimes with research, that's what we tend to find. What do y'all find? Are y'all finding that patients are concerned about autism? Derek, are you finding that your patients are concerned about this and choosing not to vaccinate, kind of like Nicole mentioned that?
Yes, I'm finding that the patients who choose not to vaccinate, they're very concerned about autism, about mercury being in the vaccines, which
Right.
still they worry about their kids' developmental health. And so most of the parents that choose not to vaccinate, they're actually delaying it, or they're actually on an alternative schedule for vaccination. But the main reason what they're worried about is just mainly autism.
And I have a great question, and anybody can answer this, but can you catch up?
Yes, you can always catch up.
Because that's an interesting thing, and I don't know that a lot of people realize that, because, Nicole may decide later on, I want my child to be a little bit older, but you can catch up on these vaccines, because I think that is very important. One of the other things I kind of want to mention to y'all and kind of have somebody comment on is thimerosal. I know that, with some of the new vaccines that have come up, there's a big issue about thimerosal, and I'm not sure I understand it. What exactly are we talking about when we talk about thimerosal?
Okay.
Go ahead.
It was a preservative, and it was our very best preservative because most of our vaccines were multi-dose vials,
Okay.
meaning like 10 doses in a vial, and you have to keep going in and out of the vial. So you have to put something in it that you can't contaminate it and then give people germs. And it was a preservative. Now, as we got to single-dose vials, or if
Right.
it's a live virus vaccine, it's not needed. You don't put preservatives in living things.
Okay.
And then in a single-dose vial, you're only going to enter it once.
Okay.
So as we do better and better, we decided to remove preservatives. Wouldn't that be nice? And do all individual dose vials. That was done in 2001 with the exception of influenza,
Okay.
because you have to do 100 million people every year with a new vaccine,
Okay.
and you can't do 100 million single-dose
Dose
vials
vials.
and vaccinate the whole country. Now we need to say about the mercury, it's ethylmercury, which is completely water soluble compared
Okay.
to methyl mercury.
Okay.
And ethyl alcohol is what we drink, and methyl alcohol will poison you.
Right.
And I know it's mercury, but it's not mercury. And then the amount is a dot. And so even if it was the worst poison in the world, like cyanide, it's a pinhead. There's no data that it ever caused any problem. But we're always improving. They've been removed. It didn't change autism.
I'm going to try and cut it here for a second because we have something that's very impressive, and I want to talk about. There's a book that you brought tonight that I really want you to talk a little bit about because I think patients can really learn about vaccines and autism. So I want to give you just a second to kind of explain this book, and we're going to put it up on the screen so that people can see it. But just a few seconds we have left. Can you just tell us what this book is?
There's an incredible book called Autism's False Prophets by Paul Offit, who's a pediatrician and infectious disease expert out of Philadelphia. He decided to be a doctor after watching iron lungs. He was in the hospital with club feet and all these children on iron lungs, and he decided, I will find a cure for disease. And he made the cure. Rototec, the rotavirus vaccine you were talking about earlier, was what he developed, can save 500,000 children. But he will tell you every detail of the story about autism, thimerosal, every detail from the beginning to the end.
And that's great. And I want y'all to realize that that's out there. We'll be right back after these messages. Today's woman. Tonight we've had a discussion. Welcome back to Health in Today's Woman. Tonight we've had a discussion about vaccines. We've done a look at what we're vaccinating against, how often we're vaccinating, some of the success stories associated with vaccines. We have also looked at some of the controversies, and we're very lucky to have a patient who's willing to come on and talk about why she chooses not to vaccinate her own children. In our last segment, we talked about autism and the connection between autism and vaccinations. This is such an important topic that I have made the decision that we're going to carry this topic to a second week. Next week, we're going to be joined by our panel again, where we're going to talk about some of the controversies associated with vaccines, but we're also going to talk about some of the new vaccines that are out there. We will find new success stories. As always, please seek any medical advice from a physician of your choice. Thank you and good night.